So good morning, good afternoon, good evening, wherever you are working. I myself, Dr. Prajjwal Pyakurel, and today's webinar, the moderator for today's webinar is Nuha Fofana. He is a field epidemiologist at Ministry of Health, the Gambia. He's a district. He was a district disease surveillance officer from 2017 to 2019. He's a public health officer from 2000, was a public health officer from 2011 to 2014. He has done MPhil in applied epidemiology from University of Ghana and BSc in public and environmental health, University of Gambia. And he's a focal point, Young World Health World Federation of Public Health Associations from 2024 to present, and he is a African Federation's board member of African Federation of Public Health Associations, and there's the president of Association of Public and Environmental Health Office and a Student Association, University of Gambia. Thank you, Noah, for for moderating this webinar, and then you can take over from here. Thank you very much.
Thank you very much, Doctor. Good morning, good afternoon, good evening, everyone. So I will go straight to introduce our guest speaker for today's webinar. And he currently is a research officer at SARC TB HIV and AIDS Center in Nepal, and also served as the Secretary General of Nepalese Society of Community Medicine. He is also the co-chair of the Non-communicable disease working group of the World Federation of Public Health Associations, and also a Lown Scholar at Harvard Teacher and School of Public Health. Going through his educational background, he holds an MD in community medicine and tropical disease. And he has expertise in clinical practice as well as in community health program implementation and supervision, of course, with a background in teaching. He's someone who is very skilled in scientific communication and epidemiological research, and also organizing large-scale health camps across the world. In terms of advocacy, he is key in the prevention of NCD through community engagement, not only in his native country, Nepal, but in other countries across the world. He has contributed or taken part in series of journal articles, as well as editorials, short communications, and newspaper articles. These are some of the awards that he have received in the past few years. Of course, one of them was the prestigious Barnard Lown Scholar Program for Cardiovascular Health, and also an award from Harvard Teacher and School of Public Health in 2016. He has ably represented Nepal in the South Asian SORT-IT course in 2017, which was conducted in Colombia, Sri Lanka, and was granted funding by the Nepal Health Research Council to study out-of-pocket health expenditures among industrial workers in Eastern Nepal in 2016. So that is our guest speaker for today. By way of introduction, I'll once again like to welcome everyone to this very important webinar. And the title of the webinar, of course, is Webinar on Non-communicable Diseases and Mental Health, focusing on a particular intervention that was conducted in central Nepal. We are thrilled to have all of you here today as we address two critical and interrelated components of global health that undoubtedly affects millions of lives worldwide. Non-communicable diseases, otherwise referred to as NCDs, encompass a range of chronic health issues such as cardiovascular diseases, cancers, respiratory diseases, and diabetes. According to the WHO, NCDs accounts for approximately 74% of all deaths globally. To put that into numbers, NCDs cause around 41 million deaths each year, with 15 million of these deaths occurring among individuals aged between 30 to 69 years. Annually, 17 million die from NCDs before reaching the age of 70. Furthermore, 86% of these premature deaths occur in low and middle income countries. And sadly, all NCD deaths, about 77%, are in low and middle income countries. So this toll underscores how NCDs do not only impact the elderly, but also strike at productive workforce, deeply affecting families, communities, and economics. Meanwhile, mental health, a fundamental aspect of overall well-being, is also facing a global crisis. According to recent estimates, more than 970 million people worldwide live in a mental health disorder, including anxiety, depression, and severe conditions like schizophrenia. Depression alone is a leading cause of disability, and together with other mental health disorders, it contributes to nearly 20% of the years lived with disability globally. To wrap up my introduction, NCDs and mental health are often deeply interconnected. Those living with chronic diseases often experience increased rates of depression and anxiety, which can exacerbate their physical conditions. And individuals with mental health challenges can be at high risk for NCDs due to factors like lifestyle changes, limited access to healthcare, and the stigma that surrounds mental health. Today, we will explore these complex issues and discuss effective approaches with the hope of doing our quota in order to reduce the global burden of NCDs and mental health challenges by inspecting a brilliant initiative conducted in Nepal by Dr. Prajjwal and his team. Notwithstanding, we will also love to hear from you, our esteemed audiences, to share expert opinion on how we can join hands towards the prevention, reduction, and management of NCDs and mental health as part of efforts to bring about a meaningful change. Once again, I would like to thank all of you for joining us today, and I'm hopeful this session will not only broaden our understanding, but also inspire action in each of our respective fields to make a lasting difference. On that note, I will want to invite our able guest speaker, who is no other than Dr. Prajjwal, to go ahead with his presentation. Dr. Prajjwal, the floor is yours.
So thank you, Nuha, for the comprehensive elaboration on NCDs and mental health, as this is a very important issues, I believe, coming, and it has been increasing not in Nepal, it has been increasing globally as well as in this and the other different regions. So my topics for today's discussion will be on NCD and mental health campaign in one of the urbanized community in central Nepal, community engagement to evidence generation. This campaign I started around 3 years back in central Nepal, and I was highly inspired by the North Karelia project in Finland, started by Professor Pesa Puska. From there, I thought of intervening at the community level, at the city level, so that NCD could be prevented. So my idea is about healthy city initiative, and I will be discussing how we have envisioned this campaign and how we are moving forward in this campaign. So I'm not, whatever. I'm not a very much expert in the field of NCDs, but whatever I've done since the last 10 years, I'll try to uh, share share to you all. So what is healthy cities? City that is continually creating and improving those physical and social environment and expanding community resources and enable people to mutually support each other in performing the function of life and develop to their maximum potential. So in the healthy city, we envision about healthy people, healthy environment, and healthy communities. It is a healthy city program is a long-term international development initiative. Place health high on the agenda of decision makers and promote comprehensive local strategies. So I am trying to promote comprehensive local strategies in this campaign. So this is the map of Kathmandu metropolitan city. Kathmandu is the capital city of Nepal, and this is one of the largest metropolitan city in the country. So there are around we can see the map of this city, and we can see there are around 32 subunits, 32 subunits, and we work in ward number 6. This is the place where we work. So what we have envisioned is we want to conduct this NCD and mental health program in this ward and subsequently scale up in other wards of Kathmandu metropolitan city. Uh, So the philosophy of when I started this campaign, I made some philosophy how I am going to proceed this campaign. So our objective is to screen, screen the participants. So we initiate the screening program. We do the diagnosis. We do the treatment. We prescribe the medication on basic medication for diabetes and hypertension, and we focus on preventive activities on primordial and primary prevention, health awareness and advocacy activities, and the community engagement, partnership, ownership, and collaborations with national and internationals, colleagues and universities, and local research. We want to do the local research, local solutions, and local ownerships. and people at a central point, population health as a central point, and targeting through community, school, colleges, and the workplaces. So we are targeting through community, school, colleges, and the workplaces. So how did we started this campaign? There is a local body in Kathmandu metropolitan city, ward number 6. There is a local body called Saraswati Nagar Sudhar Sangh. So we initiated the meeting with the local body's leaders, and envision and gave our ideas that we want to start this campaign in that particular locality. And when we proposed this idea to the local bodies, they readily accepted our idea, and suggested that they can initiate the activity in that locality. And another, collaboration, what I try to do is I try to initiate discussion with the gym clubs, in the local community. So gym clubs are those where the people go for physical activity, and they are physically active, so that, they could be an advocate for change in the community. So that was my idea when I started this campaign. uh, so now, and this is the, NESCOM is my professional body. So this is a professional body of community medicines doctors in Nepal, and there are around 250 community medicine doctors now in Nepal, and they are working very nice in the country, and they are trying to, build a preventive system and a preventive work. They are doing a lot. So this is a local body. This is written in the local language. This is the Saraswati Nagar Sudhar Sangh. This is a local body. This is the professional body. This is the 738 fitness gym clubs, and currently, two others, this Lions Club Internationals and the Leo Club of Kathmandu Parikalpana, they have also joined us as a collaborating partner for this campaign, and they are supporting us for this initiative. So, a little bit background about choosing the collaborating partner. This Saraswati Nagar Sudhar Sangh is a local body. It falls under the Kathmandu metropolitan city, ward number 6, and it is an active local body in Kathmandu city, and conduct their own election and nominate the executive member for the development of this particular community. So this community consists about, 20,000, 25,000 populations. So they have their limitations, they have their boundary, and they work on that particular area only. This and the they nominate the candidate for the voting, and they know, the elected members get selected, and they run this local body. And NESCOM is, is a professional body. Now there we have over 200 graduates and residents working in this professional body. And this 738 Fitness is a gym club. It is a physically active group and advocate for changes in the community. And this Leo Club Parikalpana is a Wings of Lions International. It is a voluntary work. And this, young colleagues, all the students, they help in data collection for this campaign. Uh, so Leo Club Find a Peace World, they have recently joined us, and they have financially supported us to buy all the blood sugar kits, and the blood pressure machines, and height weight machines, everything. They support me, and I run this campaign, and they advocate. They also advocate at the community level for this campaign. So, this is the booklet, released by this local body 4 to 5 years back, but they have not updated yet. So this is the working area. This is the boundary of this particular community. So this is the boundary, and I have envisioned this as a demographic surveillance site where I can do, all the intervention activities, health promotion activities, and create a model center, model community, so that it could be replicated to other communities in other parts of Nepal. So this is the booklet of the Saraswati Nagar Sudhar Sangh, and there are different sub-units in that particular community, and there are around 28 sub-units, and there are around 894 household, and we anticipate around 4 to 5 people in every household. So around, so this is the old one. It is produced 5 years back, but now it has to be updated, and I think they are in the process of updating this. So this is my Facebook page. So I've created the NCD and mental health campaign Facebook page. So whatever activities we do, we try to put in this page, and try to promote, and so that, people understand about NCD and mental health campaign. So these days, since this has been going on since last 3 years, and people now started recognizing that they are understanding the importance of NCD and mental health in that particular community. So this is the program schedule consists of it is a monthly program on first Saturday of every Nepali calendar month. From 7 to 8 a.m. we walk in that particular community, and from 8 to 9 a.m. we do the class related to NCD and mental health by experts. So different experts comes and give their talk on NCD and mental health. And from 9 a.m. to 1 p.m. we do the screening for blood pressure and blood sugar, and we use a glucometer and glucometer strips to identify the blood sugar and blood sugar. And for blood pressure, so we use the manual blood pressure and sometimes digital blood pressure machine as well. So this is all the promotional brochure we try to make before the campaign and promote everywhere. And this is in the local language, and we try to distribute in the local community to the people, so that they can understand about this campaign and come to the program and program. So this is the invitation letter we just try to distribute every month to the people in the community. So this is how the activities goes on. There is a waiting line. People comes and we take a registration and do the history taking, and we measure height and waist circumference and blood pressure measurement, blood sugar measurement, and we do the counseling and play the role of community physician as well, and write medication as well as do the counseling and send them to the send them and try to follow up every month. So this is all activities we do in the community, and I think a lot of people are participating these days for this campaign, and I have a strong support from the local body. They have supported me a lot, so that I can initiate this program. So this is when we do the lectures in the class, we try to make commitments to the people that we should not smoke, we should not drink alcohol, we should eat plenty of fruits and vegetables. So this is the commitment we try to do, ask them to do uh, in that program as well. So a lot of female household members that joined, the local voluntary workers, female community for voluntary workers in Nepal. We called it FCSB, and they also joined for this program. And and there is also the and we sometimes we go to the nearby park, and we try to promote the concept of healthy park initiative at the city level. So the all of this yoga team also joins us for this campaign. And similarly, all the students, the nursing professional students, and the public health students, and the community medicine doctors, and the WHOs, they have joined up for this campaign and try to support us for these important initiatives to reduce the burden of anxiety and mental health. And that is the part I previously shared in my slide, that we targeted to the community, school, colleges, and the workplaces. So in the community we do such works, and so we go to school as well, and try to motivate the young students about and teach them the importance of NCD and mental health, and the importance of primordial and primary prevention. So in the schools, when I visited a few of the schools in this particular locality, we found that a lot of young students are smokers, and that is not good. So we are trying to conduct different programs in the schools, and also the initiate the healthy food initiatives, because a lot in the public schools of Kathmandu metropolitan city, the government supports the cost of snacks in the schools. So that could also be made better in the schools. So we are trying to initiate, we are in a discussion with the metropolitan city office, to refine those food as well. And we also go for a morning walk. So this is with the school students. We went in the morning from 7 to 8 a.m. We walk with the school students and in the nearby community, and with chanting, with all the slogans, and try to make people aware about this NCD and mental health campaign initiative. And we go to the colleges, and all these are young students of Leo Club, and they also help me to conduct this program at the schools as well. And recently we have started, discussing with the banks, and in this particular committee there are a lot of banks, 4 or 5 banks. So we are trying to initiate discussion with the bank managers for to mobilize the CSR funds, for the welfare of community. That's community corporate social responsibility funds. So recently 2 of the banks have supported us, and they have supported financially and to run this campaign in this particular community. And we also, we have also started doing research in this particular community. And recently, the title of the research was "Need Assessment for Implementation of Community-Based Screening Program for Diabetes and Hypertension in Saraswat Nagar, Kathmandu, Nepal." This was a qualitative study, and we completed key informant interview and focus group discussion. And abstract was presented on the NCD conference in 2024 in Kerala, and manuscript writing is undergoing at the moment. So this is the pictures of focus group discussions, and these are all other diabetes and hypertension patients, and they are the local leaders from where we try to take the key informant interviews. And this is the poster which we presented in the Kerala conference, and the manuscript is under process, and we are writing this manuscript currently. And this has also been disseminated to the local newspaper. We have tried to write in the local language and try to distribute in the local newspaper so that people can understand about the importance of NCD and mental health. And this is my data collection team. They are all the young students who are studying in colleges, and they help me. And we have designed, a Kobo Collect applications, and Kobo Collect applications where we have installed all the applications to their respective mobiles, and I have trained them to collect the data, and they come and collect the data when we do the campaign every month. So this is all the questionnaires, and whatever the questionnaires, what we are trying to frame is a local questionnaires, the local context questionnaires. We have tried to frame the local questions. For example, these are all the junk foods, the chow chow in Nepal, well, and this is chips, cheese balls, and kurkure, titaura. These all are the local foods available, and which is not healthy, and it is a junk foods. So we want to know, how many days in a week, parents buy this sort of food to their children. So we are collecting data, and hopefully we will analyze this data and publish soon. And world the office, this Kathmandu Metropolitan City Office, Ward number 6 office, the team, they have also supported us financially as well. They have given us the money to conduct this campaign to buy the blood sugar and blood pressure kits. And the mothers group, we have more mobilized the mothers group in that particular committee to advocate for NCD and mental health. Similarly, I move around to different pharmacies, and in a lot of pharmacies, a lot of diabetes and hypertension patient comes, so from there also we try to divert the patient of diabetes and hypertension in our monthly program campaign. Similarly, microfinance companies, there are a lot of microfinance companies these days in the local community, and this woman also helps me to advocate for NCD and mental health in that particular community. And we do the rallies, and we did the rallies with WHO as well, and with SAND, and we make a show card and play card, and we try to move around the community and advocate for NCD and mental health campaign. This is a mothers group, and this mothers group, around we screen around 100 to 150 people we screened in that particular community, and this mothers group are very active in that particular community, and they help me to get a lot of participants, and we do this program, and they are still trying to engage me more on this anxiety and mental health campaign initiative. Similarly, gym association, there is a different gym associations, and in Kathmandu metropolitan city there are around 250 gym clubs. So through gym clubs we want to empower the gym trainers. We are giving the training on the importance of NCD and mental health, and they could advocate and through their gym clubs to the participants who come to the gym clubs, and they also can replicate the same in their particular community. So we are advocating from different aspects. Similarly, yoga, in this local body office, they practice yoga as well at 5 o'clock in the morning. So with the yoga team, we go for a morning walk, and try to advocate for NCD and mental health prevention. Similarly, these are the health workers team at the Metropolitan City Ward number 6 office, and they help me, to get to facilitate on the screening day, and they're mobilizing community mobilization and social mobilization. They help me a lot. And they are the female community health volunteers. There are around 5 to 6 female community health volunteers who work in this particular community, and they have been advocating for this campaign as well with me, and I think they are doing a pretty good job. And we have also our medical doctors team, and we do a checkup of the patients, and we try to write a medicine as well. Similarly, we also conduct a program with Nepal Cycle Associations. They are cycle because the cycle association, because they are physically active groups. So we try to conduct a program with cycle association as well, and try to promote the cycling, in that particular community as well. And this is the healthy park, and initially in this place, we have a lot of all the west was there, but this was cleaned up, and we developed it as a healthy park, and people can go over here, sit together, and breathe a fresh air. So this is a treatment protocol, developed by government of Nepal, on hypertension protocol, how we are going to manage hypertension at the community level. And this is the diabetes protocol, and we follow this protocol, and prescribe the medication as per this protocol. So whenever some patients comes and he or she is diagnosed as hypertension, we start with amlodipine, and we go again, and the step two, we go to amlodipine 10 from start with 5 mg, 10 mg, and then we start with the losartan, and again we go for losartan 100 mg and hydrochlorothiazide. In that way, as per the protocol, we try to manage the patient of hypertension. Similarly for diabetes as well, we start with metformin, and then we go with the glimepiride, and add 1 mg glimepiride, and further, if not controlled, we add 2 mg glimepiride as well. So we follow this protocol, and I think this is the evidence-based protocol. So this is given by the government of Nepal. So we strictly try to follow this protocol. Recently, what we are trying to do is, in that particular community, there is a there, this is a this the nearby in that particular community, there is a community hospital. Community hospital is there, and they have opened their branch in our community. There is a Sonova Healthcare, and we have connected with this local community hospital of this you know of this hospital. So we send the patients for if, for example, we do the blood sugar through random blood sugar test, and if we need a fasting blood sugar, postprandial blood sugar, and the glycated hemoglobin, we send all the patients to this center, and they immediately send the report to us in my WhatsApp or mobile, and I can see the report, and I can refer the patient, or prescribe medication as appropriate. And we have also taken our agenda to the Kathmandu Metropolitan City Office, and we have conducted a meeting with different stakeholders, the WHOs, and the Metropolitan City Office team, and the environmental health team. We have tried to initiate this Healthy City Initiative campaign in Kathmandu Metropolitan City. And currently, they have nominated me as a technical advisory group member of Kathmandu Metropolitan City. So I suggest them about the how we are going to regulate or prevent NCD at the community level. So this is our model of continuum of care. So these are our collaborating partners. NESCOM is my professional body, 738 Fitness Gym Club. This is a local body. We have reached over here, Kathmandu Metropolitan City. We have reached here. We have reached the ward number 6. We have reached the female community health volunteers. And we know we want to establish the continuum of care model. We want to establish the continuum. So whenever we take the patient monthly to do the program, and we want to refer them to lab, and prescribe medication and counter referral, we also want to build a strong chain of counter referral mechanism as well. So we are working on this part. I think we have not strengthened this part. We have reached all this part, but we are still lacking on this part. And I think we want to follow up our patients strictly, and avoid loss to follow up. So preliminary data, a few data I had, so I try to analyze those data. So this is the reports of the report released by the government of Nepal, and this is the annual report. This is the Nepal NCDI Poverty Commission report on NCDs, where the DALIs for cardiovascular disease is around 17%. Prevalence of raised BP and raised blood sugar is 24.5% and 5.8% respectively, as per the non-communicable disease risk factors STEP survey 2019. And around 9.8% of total death is due to COPD, as per the Nepal Burden of Disease 2017. So this is the age distributions. We can see around 65% are the females who come in for this campaign. So you can see the systolic blood pressure, mean systolic blood pressure, and diastolic blood pressure, and I think a lot of them are as per the JNC7 classification, they are in the pre-hypertension group. So we are also trying to initiate bring this pre-hypertension and pre-diabetic group, and have started the diabetes prevention program module as well. So this is the BMI. Around 43.5% were found to be overweight, and around 8% has a was found to be diabetic in random blood sugar, and the history of around 25% had a history of hypertension. Around 14.3% had a history of diabetes. Around 2.7% had hyperdyslipidemia. 8.1% has a thyroid disorder. A lot of people come with hypothyroidism in that particular committee as well. So we found a lot of cases of hypothyroidism over here. And tobacco use, I think since this is a ritual community, cultural community, so the tobacco consumption is very less in this particular community, and the alcohol consumption is also very less in this particular community. So this is the baseline data we have collected. So recently, what we are trying to do is we are screening the participants and identifying the pre-diabetic and pre-hypertension participants, and trying to put them on interventions. So these are all the screening campaign we do, and this is my team. And so, for those who are found to be pre-diabetic and pre-hypertension, we have started recently, since last 2 or 3 months, we have started this diabetes prevention program. So diabetes prevention program is a lifestyle change program that helps people at risk for type 2 diabetes reduce their risk by eating healthier, exercising more, and improving coping skills. There are 16 modules in DPP. So there are 16 modules. So we have started these modules in this particular community. So there are 16 modules. So what literature shows is when you intervene in the pre-diabetic or pre-hypertension stage, there is a reduction of 60%, of not having diabetes in the future. So we are going with the literature data, evidence data. So the first module is about introduction and goal setting, stress management, healthy eating, measuring portion size, identifying healthy carbs and fat, move your muscle, being active, food and activity cues, balanced diet, problem solving, and similarly, alcohol and tobacco, and the ways to stay motivated. So every week, we try to conduct one classes to the pre-diabetic and pre-hypertension participants, and we try to maintain the booklet, so that they can write, and whenever they come after 1 week, we can check their booklet, and suggest as appropriate on healthy diet and physical activity. So this is the week 1 and week 2 modules which we have done. We have done the pre-test questionnaire, and we have asked the participants what they understand about this NCDs, mental health, diabetes, hypertension, pre-diabetic, pre-hypertension. You know, so this is the week 3 and week 4 classes which we have recently conducted. And we are also doing, with this Lown Scholar program at Harvard School, we are doing this PDSA, Plan to Study Act. So we have done the screening, and we have tried to identify number of people attended the workshop, and how many people have been monitored, and we have trying to bring some outcomes with this PDSA as well. So current situation, screened and imparted knowledge regarding NCD and mental health in about 3,000 participants in last 3 years, and it's still continuing. So I think we have done around screening for more than 3,000 now, last 3 years, and it's still continuing. And engagement with multiple stakeholders, environmental health scientists, and public health researchers, community physician, educationalists, and local political leaders. Everybody has helped us to run this campaign, and we have a strong hold at communities and schools, and the workplace we have started, because in the workplaces, especially at the banking sector, all of them sit in the chair and do the work. So we have also tried to initiate at the workplace setting as well. And currently I'm the core technical team of this Kathmandu Metropolitan City for NCD prevention, and community with a connection with the community health centers for continuum of care. And we are trying to bid for a R1 NIS grant with Lown Scholar programs in Nepal as well for this initiative. So my conclusion for this, NCD mental health campaign is such program can be initiated at different places at a very low cost in collaboration with local bodies. So the cost is very nominal. Just we have to have the glucometer kit and the blood pressure. That's all. You can check the diabetes and the hypertension status. Avoid a lot of administrative and bureaucratic hurdles. So when you work in the academic sector, in the different different ministries, there are a lot of channels and bureaucracy, the administrations, and we avoid those lot of administrative and bureaucratic hurdles, and we directly reach to the community and leadership of your own. This gives you the to showcase your leadership as well, and there is a recognition at your own places. And I was recognized by this particular community for my initiative on NCD and mental health campaign. And with this, we have come to the end of this presentation. I'll show the short videos, what we did, and then we'll end the program. Noah, are you able to see this video?
Yes, yes, of course, of course. We are seeing, of course. Thank you. Yeah, so we can take a few moments to look at this video together.
So this community is an excellent example of this, which I saw from the morning. Physical health, you practice. Mental health, you are practicing. Okay. Okay. And social well-being. So I can see the social atmosphere which you have among the elderly, the young, the very young, male, female, in a very nice setting. And this is actually a good example of practical implementation of this WHO definition of health.
Thank you very much, Nuha. This brings to the end of my presentations, and over to you, Nuha.
Thank you very much, Dr. Prajjwal, for that very brilliant presentation. It was very, very brilliant, and I enjoyed the entire process of the presentation. So I would like to take a few minutes to just give a summary of what has been presented by Dr. Prajjwal, especially for the benefit of some of us who came late to the webinar. So first, of course, I mean, he started by sharing with us the entire vision, or the mission of his intervention, which is, of course, to have a healthy city. And of course, if you say a healthy city, it's not only limited to the human beings, but the environment as well. So he later on take us through the methodology that was undertaken by him and his team to ensure that they have a healthy city. And among those, of course, it includes a screening of individuals to ascertain their status as far as NCDs are concerned, most especially diabetes and hypertension. And of course, they go further to provide advice or to provide treatment for some of the patients that have been diagnosed for any of the NCDs. And what I enjoyed, or what I like most, is the fact that they use existing national protocols or policies that the countries are currently having to make sure they follow the right protocol in terms of treatment of the people that have been diagnosed of NCDs. And by way of prevention, they do series of activities or interventions at the community level with full participation of the community. Some of those include, Work for Health. And also one very good thing that they do is to conduct health talks or classes for community members to equip community members, with the requisite knowledge of that they can use to actually prevent themselves and their communities from becoming victims of NCDs. And throughout his intervention or throughout his presentation, he has showcased the importance of partnership. I'm very much curious, maybe that will come later, as to how he's able to, get a lot of partners, to support his initiative. That was indeed brilliant. And again, to have as many people as possible on board, they also include a social media campaign by having a WhatsApp platform where people can log in and learn as much as possible to know of the activities and even take part in the good work that they are doing. So that was brilliant. And one of the things too that they did well is to go through to these institutions we have in our communities to make sure they take care of, or they commit to their community social responsibilities. That is very important. And also they conducted, a research, because whatever we now live in a scientific world, whatever you're trying to talk about, you should be able to have or generate, evidences for it. So of course, they conducted the research, which is currently under, and they are, of course, at the moment trying to develop a manuscript for that. So that is a very good initiative by Dr. Prajjwal and the team. And the multifaceted approach that they use in battling NCDs is very fascinating. So trying to use as many possible interventions as possible to make sure, they have a healthy city. And one of the things that caught my eye was trying to identify prehypertensive and pre-diabetic patients during their screening exercises. So that was another, brilliant initiative or achievement which they are able to achieve from the interventions that they are able to undertake. So briefly, these are just some of the things I want to share with all of us, especially those that have joined us late. So at this juncture, I want to thank again Dr. Prajjwal for this very important and interesting presentation. And we'll now open the floor for any questions or interventions. But before that, I think we have some questions already in the chat box. So I will read the first question we have in the chat box, and Dr. Rajwal, you can go ahead and give your answer. So first, it is from Aaron, and the question reads, very impressive and creative community intervention. The partnership with the gyms and educational frameworks is a nice approach. I have two questions. Number one, in thinking about a healthy cities approach, what kind of buy-in do you have from the municipality? And the question goes further, are there barriers or requirements that needed to be addressed? What kind of evaluation have you been able to conduct to evaluate the intervention? So, Dr. Rajwal, the floor is yours.
Thank you, Aaron, for the wonderful questions, So I think, the local community has been very supportive. The channel, what we do is whenever I need something, I write a letter to the local bodies, and they forwarded those letters to the ward office, and from ward office it goes to the municipal office. In that way, it flows. And they try to provide me the all the financial support, and I think there has not been much barrier for this, and because this is not a huge amount, so there is not a barrier because they have a dedicated budget for that program, and they try to distribute me. And sometimes, due to political influence, local political interest, the people have their own interest, especially the local leaders who facilitate to help me, and they try to influence in one way or another. That is the case in context of in our part of the world. But I think we are able to manage all this blood sugar and blood pressure kits. We have been doing that. So I don't think there is much barrier. And sometimes, different political parties, because this is political bodies, and there might be, sometimes conflict of the programs, so sometimes it happens. But I think in the 95% of time, it has been successful. So regarding your next question, what kind of evaluation have you been able to conduct to evaluate the intervention? So, evaluations, what we are trying to do is recently, I'm working with the Harvard School of Public Health, on developing, the PDSA model, Plan, Do, Study, Act model. So, we have screened the participants. We have made all this run chart, process map, everything. We are trying to do that. And we are trying to see the changes, how much in the 16 weeks, when we started this diabetes prevention program modules. So in the 16 weeks, how much there will be a change in the blood sugar or blood pressure level, and then and we are trying to evaluate in that way as well. So after 16 weeks, hopefully, there is a in the diabetes prevention program module also, there is a 5% target of reduction of weight and 150 minutes of physical activity, and there are a lot of classes. So hopefully after 16 weeks of completion of these modules, we can bring some concrete outcome and results, and then we can evaluate our programs. And that way we are thinking, Aaron. Did I answer your questions, Aaron?
Okay, so I hope they'll be able to unmute themselves and respond. So, Aaron, are you okay with the response, or you need further
Yes. Oh,
clarifications?
that's wonderful. I didn't know I could unmute. So yes, Prajjwal, that's very helpful. Thank you. Can I follow up on that?
Yeah,
Yeah,
you
sure.
please go ahead.
Please go
Yeah,
ahead.
sure.
So when you design this, it's it's really wonderful that you can do so much with community buy-in and limited resources. Obviously, it's nice to have even more resources, but I think the community engagement is part of the idea of a healthy cities approach. And so you can look at blood sugar reductions or weight reductions, physical activity increases, one kind of measure. Community engagement itself would be another measure of outcome. And I wonder what your thinking was on how to define your targets. As in, what would you consider success? Where are the things that you feel you've been really successful and that you're happy with, and where are the areas, even before you measure and have charts and tables, where you feel like, oh, I think we need to be doing more?
So Aaron, my basic concept in this campaign is, especially to identify the pre-diabetic and pre-hypertension participants and put them on this intervention program. That is my basic idea. So I think, we have recently started this initiative because, well, since last 2 or 3 years, we have only been doing the screening. And when I have a hold in this particular committee, and I started doing interventions now. So I think the basic idea is identifying the pre-diabetic and pre-hypertension participants and put them on diabetes prevention program model and see the changes, in the blood sugar and blood pressure level around. That's my idea.
But do you say if you get 50 people in, if you get 100 people in, if you get certain kinds of ripple effects within the community, because you want this to be a model that can be copied.
Yeah.
And so you need to also get, it's great that you have good support where you are, but the other wards or other cities will then need to see that there's something that compels them to do the same, maybe with different people in different settings and politics and all the rest. So it's really a question of how you think about where you can show your exciting success, and is it only qualitative perhaps, or do you have like targets that you can feel you've made impact? So what do you consider success, not only locally but in terms of the expansion, and what do other people need to hear from you in order to buy in and try to replicate the intervention? Does that make sense?
Yeah. So, Aaron, what I'm trying to focus in this particular community is, we have to learn from, global health teaching, and we have to use our medical and public health knowledge and addressing the social determinants of health, and understand the local context. So that is my approach. So what I want to show to the people is, for example, if there is a, interventions going on in the western part of the world, it may not be applicable in our part of the world. So I'm trying to showcase the international community that, local interventions, we have to promote the local interventions so that it could be more sustainable in the future. That is my idea. For example, in the local foods, there are a lot of local healthy foods in context of Nepal. So we want to promote those local healthy foods so that people eat those foods, and that could be more sustainable than, than the other ways. That's my idea, Aaron.
Right. Well, I like
Okay.
that very much. I think it's wonderful if you can then, you talked about take the global and bring it to the local in Nepal, but you also have what we learned from Nepal. I think you'll have something important to tell everyone else, and that's wonderful when, to be able to see how that'll advance.
So Aaron, and this is the Kathmandu metropolitan city is a very crowded. It is a capital city. It is very crowded, and there are very less physical space, for physical activity. But the current mayor, who is the mayor of the Kathmandu metropolitan city, is trying to make different parks and, open gyms and for the people to walk around. But in our community, I don't think there is a much larger space and, to work, and one of the environmental scientists who came in this particular community, and there was a lot of waste, in one places, and he disposed all those wastes and he created a healthy park. So they have promoted in that way, and in that way we are trying to promote, everywhere whenever we are going, and wherever we see the waste over there, and we try to talk with the ward office, municipal office, and try to develop them as a healthy park. So we have been advocating for that with the municipal office. And uh, food environment, in the food environment, I think, as everywhere in every part of the world, there is a lot of, selling of the junk foods, alcohol, and this smoking and the tobacco are very easily as available in our part of the world. So, although people knows these things, they know that food, they have to be healthy, they have to eat healthy food. But I don't think, we need much more improvement. And recently I'm also part of Nepal NCD Alliance. So I've been working with the Nepal NCD Alliance on advocating for junk foods with the municipal office. So in their policy documents, we are trying to, ban the junk foods at Kathmandu metropolitan city. So hopefully, I think in the next week we have a meeting with them, and hopefully they can put this in their policy documents.
Thank you very much.
Okay. So there's another question for you in the chat box, Dr. Prajjwal, and it reads, do you have training to build trainers in the community? And if so, these trained people then can take it up to other parts of the city or country? That's the question from Mina.
Yeah, so we have not designed in the standard training models for this, but what we do is lot of the young, MBBS students and the nursing students, public health students, or the residents of MD community medicine. They come over here and they try to learn over here, and then they do the lectures and they do the practical sessions and as well. But we have not, because in Nepal, the government of Nepal has their own, standard training modules, so package of essential non-communicable disease intervention. So that is the training program the government of Nepal runs, and it has been in all the 77 districts of the country. So I don't think we have to try to duplicate those TOT models in our part, but rather than we are trying to facilitate the Ministry of Health, government of Nepal, to learn from our experience and incorporate in that particular modules. So we have given our experiences at the local community to them as well, so that they can incorporate in their model as well. Yeah.
Okay. So, Doctor, I will go ahead to ask my question. I think one of the interesting things that is captivating from your presentation is your ability to entice, to forge partnerships with institutions and stakeholders in your community, which is something that is very, very difficult sometimes in some contexts. But there was something interesting you mentioned, and that is sometimes some of these interventions or partnerships will come with strings attached. Let's say they also have some other interests, attached to the partnership. How do you balance these two to make sure your ultimate goal is not being diluted? How do you go about this? That would be my question. Thank you.
So, Nuha, what I told you initially in my first the initial slide is, we are targeting these interventions through these schools, community, schools, colleges, community, and the workplaces. So this is our target. This is our so we are a focused target. So we will go to schools, we will go to the workplaces, and we will go to the community and and start the interventions on NCD and mental health prevention. So that is our goal. The goal is pretty much clear in our side. So regarding the balancing the community engagement part, so because the local bodies over here are very much supportive, to me for this initiative. So they also help me, for the community engagement. So they have a hold. They know everybody in this particular community, and they help me to facilitate for example, if I have to go to the schools, they will talk with the principal of the schools, and they will try to facilitate me, and I go to the schools and I try to convince them, so about this initiative. Similarly, in that way, in the banking sector, they help me to connect with the banking managers. So I go there and try to build the partnership with them. So in that way, it has been working, and I think because if there has not been support of local bodies for me, then it would have been difficult to penetrate in the community at the community level. But because of the support of the local political leaders, I'm able to do that. And another part is, since I've been running this campaign since last 2 to 3 years now, and people started believing in my initiatives. So so whatever I do, when I call when I call them call them, they will definitely come to my program. So it has it has increased day by day, and because of support of all the different stakeholders in the particular committee, I think the program has been successful till date, and we have to evaluate more in upcoming case. Noah, over to you.
So maybe my final question. In your presentation, one of the things you want to achieve is discouraging sale of junk foods in your community. Personally, I think that is a very difficult task to accomplish, or an achievement to accomplish. I want to know how far you have gone with that, and how do you intend to achieve that? Back to you.
Okay, so regarding the junk food, it is very challenging. Junk food banning at the community level is very challenging, and although we try to advocate to the parents, to the students, but it has not been practical scenario. So what I am thinking now is we have to intervene at the policy level. If we have to avoid the junk foods at the schools, and we have to avoid the selling of junk foods in the periphery of the schools, we have to intervene at the policy level. So we are in the dialogue with the Kathmandu Metropolitan City team, and we are trying to meet the mayor of the city, and next week we have a stakeholder meeting with this Kathmandu Metropolitan City team. And in that KMC office, there are different departments. There's a food department, there's a health department, and there is a the policy planning division, and the law section, everybody. And we have tried to call them everybody in one forum, in the one. Hopefully we have a meeting next week, and then we'll try to discuss this, and we will try to write those the policy things at their policy documents, and the implementation part, regarding the most difficult part is the implementation part. And the metropolitan city have their own local police. So I believe what we are trying to advocate is, please write in your policy documents, and if it is written in policy documents, and let's try to implement at the community level. So through the help of this local police, we'll try to impose food ban, junk food ban especially at the 200-meter periphery of school premises, and subsequently at the community level. But there are a lot of challenges. That's not easy tasks. For example, recently the Kathmandu Metropolitan City banned the tobacco products in the city, but there was a it was taken to the Supreme Court of the country. The powerful tobacco industry did not allow to happen that. And it was taken to Supreme Court of the country, and it is still going. And they have tried, but we have to identify
Yeah.
what are the what will be the next. If we ban the junk food, what will be the reaction of the food
Mhm,
industry. We have to
mhm,
think from that
mhm.
perspective as well. So a lot of homework is needed, I believe, and nitty-gritty parts should be identified, and we have to explore all those things, and plan our this food advocacy banning at the schools and on the community level.
Thank you very much. I love the fact that, as far as banning junk foods are concerned, you have, targeted locations for now. I mean, let's say against trying to implement it in the entire city. And I think gradually, like you mentioned, targeting schools, targeting colleges, I think
So,
those
Noah,
places could be a good start point here. Yeah, go ahead. Go ahead.
so what we are thinking is, in Kathmandu Metropolitan City there are around 90 plus school, 90 plus public schools. So
Mhm,
if we can influence the Metropolitan City team, and the mayor and the deputy mayor, and the deputy mayor, and we can put that in the policy documents, at least in the 90 schools of Kathmandu Metropolitan City, we can do that. That's our idea.
mhm.
So from there we'll start and see how it goes, and then we'll subsequently expand it and scale up further.
Yeah, that's brilliant. Exactly what I was emphasizing. I mean, starting somewhere and try to see, I mean, how it fares. Because of course, in trying to ban junk foods, like you mentioned earlier on, again, you need to have in place, substitutes, other healthier foods, which people will have access to. I mean, rather than going hungry. So I think it's the right move in the right direction.
Thank you, Noah. I think it is my pleasure, to share my experiences to all of you in this, me in this webinar, and I hope this could be replicated. This is not a Nepal problem; it is a global problem, I believe. So I think it has to be taken to every part of the world. So let's learn from each other's experience in different parts of the world, and try to replicate the your own country's models, as per the experience we learned from different speakers, and let's work for the prevention of NCDs for the global populations. Noah, thank you very much, Noah. Thank you very much.